The Pat Kenny Show
with Aviva Insurance
on News Talk.
500,000 members will be receiving their January health insurance renewal notices in the next 3 weeks. Now, we know there have been a number of premium increases during the year, which may now accumulate on your renewal quote. What can we do to reduce the burden? I'm joined by Dermot Good of healthinsuranceIreland.ie. Dermot, good morning.
Good morning, Pat.
First of all, it's a huge number of people facing these quotes just coming up to Christmas.
It is the worst time of the year for health insurance for consumers. So, unfortunately, it's a legacy issue that nearly 500,000 people renew on the 1st of January. And all those notices will go out, as you say, in the next 2 to 3 weeks. And here's what's going to happen. So, first of all, as we said already, these people need to brace themselves. It is not going to be 3 or 4% of an increase. They will be lucky if it's 8 to 10%. Most people may be close to 15%. But the people on the older plans, and these are the plans that are in the market 5-10 years, they're facing increases, Pat, of up to 25-27%. So
will everyone have an increase?
Everybody has an increase, yeah. So right across the board, but some plans are being more impacted than others. Now, the other thing that people don't realise, and this happens at this time of the year every year, when those notices land, there is literally a tsunami of inquiries to the insurance companies. You will struggle to get through sometimes. You might struggle to get an appointment with an advisor and so on, because so many people want to try and sort out their health insurance before Christmas. So what I would say to everybody now, don't wait until the end of this month. Start doing the research now, because then you might give yourself plenty of time.
So even before the letter arrives in the post?
Absolutely, because for most of them, there will be a few changes on the 1st of January, and we're still waiting for full details of them. But most of the rates, we have visibility on the January rates. I can tell most people what the renewal is going to be now with most of the insurance companies. So they mightn't be able to change your cover until closer to the renewal, but you can do your homework and do your research now. And research is the key thing, because when I was doing my analysis, and we talk about these dated plans, and each of the insurance companies have examples of these. So what's happening is here, Pat, people are staying on the same plan for 5, 10, 15 years. And there's nothing, by the way, most of these are still very good plans. And it's not something that the insurance companies have done. It's just a lot of it is consumer inertia. And they just keep renewing because they're afraid, particularly older members, of making changes. When I looked at some of these plans, some of the savings, some of the costs on those plans now are just astronomical. Because if you add 10% to a plan, that's €9,000. 9,000. Now you're looking at nearly 10,000 per adult for the next renewal. And there are plans at that premium at the moment.
Are the companies making money?
Well, they're not complaining, which really means they are making money. And the market has still increased. So even though with all these increases, believe it or not, the market went from 2.52 million to just up to 2.53 million. So there's still, it's smaller numbers, but still more people are taking out private health insurance because they don't want to wait on the public system.
There are also those corporate plans. Say you get, the tech companies down in Silicon Docks in Dublin and elsewhere around the country, and they offer health insurance as part of the employment package that comes with the job. And those people generally are young and healthy, so the insurance companies must be making money there.
Well, that's the business that they actively chase, of course, because that subsidises, their book in terms of the older members who are claiming. But Pat, you and I have spoken about this lots of times. People need to realise those corporate plans are available to everybody. So right now, the VHI PMI 4316, which is just over €1,600, the Leia Connect Choice, which is 1668, and Irish Life Health have this, it's called the Health Guide 2, 1778. They have a whole range they are fantastic semi-private corporate plans that anybody, whether you're 26 or 76, can join. And I want to give your listeners an example right now. So if we take, let's just say, some people are on these executive plans costing €9,800. There are corporate plans that are maybe a third of the premium, €3,750, €4,000. You may not be fully covered for your hip and knee replacements, but you still have the same hospital cover. But you could save maybe €5,000 per adult. You could have 2 hip replacements during the year and still save money.
Now, there was a new entrant during the last year or so, Level Health. And I remember reading somewhere there was a freeze. Was there or wasn't there?
There is a price freeze. So what they did have an increase in April, just like the other insurance companies, because they are paying claims. They have a very simple product range. They seem to be doing very well. I'm expecting them to launch 2 new plans on the 1st of December. So I think they're committed to having a very small, simple product range. The other insurance companies have 90 to 130 plans each. And yes, they've announced that they will have a price freeze, so there will be no price increase with them until at the earliest the 1st of February. we will expect some insurance companies may increase on the 1st of January. And by the way, Level Health did not go up in October when all the others did. So good news for Level Health members. And I would say any families listening now. So there are deals there. Level Health, if you have any children under the age of 3, on all the Level Health plans, they are free. And if you have kids aged 3 to 17, you get a 50% discount on some of their plans. So it is so worthwhile shopping around. I mean, if I can say, Pat, to everybody now with health insurance, the days of auto-renewing, letting your plan roll over are gone, okay? And the people who are going to be really impacted by these increases, I mean, I was looking at some of the increases. You're talking like 25, 27% on some of the older plans. That is 550 to 950 euro per adult. You know, so it just, for a lot of people, this is
now,
not even affordable.
Are they coining it on this inertia, or are they saying, we'll price them so that people don't take them and we can just drop them off our books? Which is it?
Well, there's a couple of things. It is both, Pat. And here's what's happening. So a lot of these older plans are very expensive for 2 reasons. Number one is because of the length of time they're on the market. Like I see some of the Leia plans there, they're there 20 years. Now, Leia will write out to these people and actively encourage them to engage, but a lot of people just don't. But the other thing, these plans that fully cover the hip replacements, knee and shoulder replacements, they tend to be priced accordingly, and they are very expensive. But if I can give you an example right now, there are people paying, so let's just take Leia, and there's examples with all of them. So Company Care Plus with Leia is €4,600, and it's super cover. But they have another plan right now called Prosper Advanced, which is you'd struggle to find the differences. It's €2,400, and you keep your full cover for the hips, knees and shoulders. And the same, like anybody with Irish Life Health is on the Business Plan Complete or the Business Plan Extra. Any plan starting with Business Plan or with Optimise, those plans are good plans, but they're too expensive in my view. You can phone Irish Life Health today and check out the 4D Health 4. Like, Pat, in some cases you'll save nearly €2,000 for very similar cover.
Now, you have a press release which was reproduced in the newspapers. Don't choose these, a list of plans, just not to choose. I'm not going to go through them here because it would take a long time, but there are 35 plans you say, don't do this.
Well, what I would say to anybody on those plans, and by the way, there's another list I could provide, like that's just a start. But what I'd say to anybody on those plans is, are they good plans? Yes. Are they good value for money? In my view, there's a big question mark over the value for money return on some of those plans. And all I would say to anybody who's on those plans, like, don't worry, you still have good cover. But what you need to do is you need to phone your insurance company immediately.
So it's about price, it's not about cover.
Absolutely. Those plans, like, when you think about it, those plans are on the market, some of them 15, 20 years. So when we talk about the price increases in the last year alone, which had a 25% cumulative increase, those plans have been hit by all those increases all over the last, right through the downturn when the rates went up 15, 20%. If you phone, and what I'd say to everybody now, phone your existing insurance company and simply say, that's too expensive. Do you have something similar with similar benefits? And don't forget
and tell me what I'm losing.
That's it. And tell them your budget, by the way. But like when I look at some of those plans, to be fair to the insurance companies, they all have a fantastic range of alternatives. Like anybody with VHI on premium care, they've just brought out Premium Care Select, which is cheaper, and you'll struggle to see the differences. And they have another plan, I think it's the PMI 6410, which is basically about another €1,500 cheaper. There's some minor differences in orthopedics or whatever. So there are plans there to suit everybody. I mean, one of the criticisms of the market, which I don't buy into, people will say there's too many plans. But Pat, I remember the days when there was only 20 plans and there's no competition. So now there are plans to suit everybody. If you engage with the insurance companies and tell them you're not happy with the renewal, tell them your budget and keep them on the phone and get them to explain the other options that they have, they must go through all their plans with you. They have to tell you what the best deals are and they have to explain it to you. And that's the way. And then let them go through all the 150 plans that they have. You don't need to worry about that.
Now, the question is, if everybody adopts this tactic that you're recommending, well, then that means the revenue for the insurance companies goes down. And therefore, in order to maintain their profitability, they'll up all the prices. So, you know, they're going to try to keep their margin, aren't they?
They are. And look, insurance companies, you know, they've an obligation, even under central bank rules, they have to maintain certain minimum solvency levels. And it is a balancing act between premium and claims. And claims are on the increase right across the board. But what I would say, like Pat, there are plans there right now. Those plans, and it's only 35 at the moment. Now, there's not 50 or 100,000 people on these plans. There's a small number of people on these plans. But these plans are just way too expensive. They're not affordable. So I would say to anybody on those plans right now, why would you pay $9,800 per adult when there might be another plan there that's $5,000 per adult that gives you the same cover? And what I'm calling on now, if I may, any like children, you know, people who have elderly parents, elderly relatives, they're terrified to make any changes to their cover. In fact, they don't even probably know the plan that they're on. They let it roll over every year. You need to ask them to show, let's just say, exactly what plan they have, see with the premium, and you be with them when they phone the insurance company. You basically hold their hand and walk them through the process. There are plenty of advisors out there who will do it for them, but these premiums for a lot of people, I've had more calls, Pat, the way to look at this, I've had more calls, I'd say, in the last 6 weeks from people simply saying, I can't afford this premium. Is there another option? And there's going to be more of that, and a lot of people now need to brace themselves for that type of impact when those renewal notices land.
A couple of quick questions. Do you need to insure children? And I mean, we're going to, in the next couple of years, perhaps have a new paediatric hospital open at St. James, which will be the Rolls-Royce of children's hospitals, we're told. And under, the normal HSE rules, every kid should go in free.
Yeah, and right now, every child going into a public hospital is free. There's no charge whatsoever. I would always encourage people to please try and keep your children on the policy for a number of reasons, because if you take your child off the policy and you add them on later and they have an underlying condition, they will not be covered for 5 years for that existing condition. And right now, like Leia Healthcare will have a free kids offer on the 1st of January. There's also the deal right now with Level Health. But even with VHI and all of them, they all have great deals. And what you need to do is split your cover. Put your children on the lowest, cheapest plan, maybe €150 per child, and then put the adults on appropriate cover. But don't have young children on the same level of cover as mum and dad. And Pat, the other thing too as well, whether we like it or not, you could wait 6 months to get a tonsillectomy through the public system, because the waiting list, 10% of all of those people on waiting lists are children. If you have the health insurance, you can bypass that. That is the reality of the situation.
Okay, another question, a general question, because we're trying to keep it general, and I'll come to a few specifics in a moment or two. Does your health insurance policy generally cover you for travel abroad?
So it does to a degree. Most plans will have €100,000 worth of emergency medical cover. But that's really kind of a stopgap. If you're travelling throughout Europe, you could say it's adequate if you have your EHIC card, the European Health Insurance card as well. Pat, I advise everybody to take a proper travel insurance. If you're going further afield, outside of Europe, especially to the US, you must have proper travel insurance. And there's loads of companies. You can buy it online. There's AIG, there's VHI, there's the AA, there's loads of policies there. They will cover you up to 5 or maybe even 10 million. A word of warning though, and this happens all the time. Every week I'll get a phone call from somebody who has a child in Australia or travelling, and they bought an off-the-shelf travel policy. They have no cover. Those policies only last for maybe 45, 60 days. You need to have a proper policy, either a backpacker or like a VHI international policy to cover them. But yes, make sure you have, proper travel cover. If you think it's complicated here, wait till you try and get a claim paid when you get treated overseas.
Now, some of the questions. My partner is currently being treated for a long-term illness covered by our current plan. Is it possible to change plan without losing cover?
Absolutely. So, like what I would say to any person who has an existing condition, and this stops a lot of people shopping around. First of all, you shop with your existing insurance company and see do they have something similar that's cheaper, because they have all your records. If they don't, and you see something with another insurance company that has everything you need, you phone them up, but tell them what the underlying condition is. Yeah. Tell them which hospital, which doctor, which scan centres, and they are obliged to tell you, yes, Dermot, that's covered.
Interesting one here. Can Dermot please explain this? My 24-hour blood pressure monitor from my GP costs €20. 24-hour blood pressure monitor from a private hospital, the fee, €120. Why is the cost difference so extreme? I don't understand it.
No, look, what you tend to see sometimes, just think of it like this. The overheads of running a GP practice are obviously much smaller. When you go into a private hospital, you get anything done. They're pricing in everything, all the technology, all the staff, everything. So that's why, for example, people will say, I had a small day case procedure, a heart procedure, and it cost $25,000. I was in and out in the same day. But what they don't realise, it's $25,000 fixed. So if Dermot is in for a month, it's $25,000. If you're in for a day, it's $25,000. So look, there will be those disparities in terms of costs or whatever. That's not unusual.
Any cheaper options for a company which has employees on VHI, PMI, 3613? We've been on this plan for over 3 years.
Absolutely. And I should have mentioned, Pat, small employers are probably the ones that are really overpaying because they're afraid to change their benefits and having to tell staff there's any change. That plan right now today, €1,895. it is a good semi-private corporate plan. That person should check out, for example, VHI PMI 3112, and that plan today is 1,677. Virtually the same plan, and there's €300 of a saving. And they have another plan too as well, the VHI PMI 2111, and that's 1722.
Do you have to tell your employees that you're changing? Because someone might actually be claiming for a particular thing that might be covered by one, but not covered by the other.
You do and you should. And look, the insurance companies will support you on this. So all that person has to do is phone up VHI and simply say, look, do you have a lower cost equivalent, which they do. Mention those two plans, the 2111, the 3112. Make sure you're getting the full discount from VHI on those plans. And then VHI will design a communication for your employees to explain the subtle differences, but there will be no break in cover. And also they will engage with the staff in case anybody's in claim or whatever to make sure nobody is disadvantaged by the move. But it's a very good plan that they should be checking the alternatives.
What's the best health insurance plan for a single person just wanting to ensure that consultants' fees are included?
So for that person, I would suggest, and I don't know what age they are, but they really need to be looking at the good corporate plans, Pat, because they will cover them in good hospital cover and 50% back on everything. So some of the plans, actually the lowest cost ones right now, there's new plans that have just come out. Irish Life Health have just launched a new plan called Health Action 1, probably the cheapest plan at $1,300. Lay have just launched a new plan called Inspire Care, which is 1590. I mentioned the VHI PMI 4316, which is 1613. The new company, Level Health, don't have any corporate plans just at this moment in time, but they will have from the 1st of December. But like for that person or anybody, all they do, first of all, before they pick up the phone to the insurance company, how much am I going to spend on this? What's my disposable spend? And then you phone each of the insurance companies and tell them, I want good cover for routine expenses. Here's my budget. And sit back and let them go through all the plans. By the way, I should say, anybody who can't afford health insurance and they want cover for everyday expenses, don't forget the cash plans in the market. All the young people who can't afford health insurance, the HSF cash plans give brilliant cover for that.
Please, could you ask Dermot, what would be best for my 92-year-old mother who's in poor health in a nursing home? She's on advanced care 50, but I was thinking of reducing her cover for a lower premium. That's from Grania.
Okay, so the plan that they're on right now is €2,610. It is a good plan, but it's really for somebody who's with VHI who wants a private room and also, Pat, who wants to keep full cover for the hip, the knee, the shoulder replacements and the cataracts. Somebody of that age, the likelihood is they're not going to be having that surgery. So they need to get advice, but I always advise, as people get much older in the nursing homes, taper the cover back, they should actually check out that PMI 4316 that I mentioned with VHI. It'll save them €1,000 and it's still very, very good cover.
Will my employer, which is a large multinational, just pick the best value plan for me? Can I just do nothing and forget about it?
Well, anybody who's lucky to be in a multinational that provides healthcare benefits, they really don't have to do anything. The employer does it for them. Now, some employers are very good and they get the best deals and they get phenomenal deals now from the insurance company. But some employers, particularly small to medium-sized ones, they don't. They let it roll over, Pat. They don't want to engage. I'd need to know the name of the plan, but the likelihood is they are getting fantastic cover and sit back and let the employer do the heavy lifting for them.
My insurance expires on the 21st of December, but I have a planned procedure for the 14th of January based on my current plan, which now will probably be too expensive to renew. What should I do?
Well, so I wouldn't worry about this. All they have to do, first of all, is engage with the insurance company and just simply ask, once again, do you have similar cover at lower premium, and tell them your budget. And then get the procedure code for the procedure you're getting done in January. And all you do is you ask the insurance company, will that new plan cover that procedure code to the same degree, and give them the consultant's name and so on. The Irish psyche, the psyche everywhere with insurance companies is tell them nothing. But the good thing with health insurance in this country, if you tell them everything, Pat, what you're getting done, the procedure, they will just tell you what your cover is. There's no downsides to disclosing those things up front.
Now, those plans to avoid, people want to know where can they find that list? On your website?
It's not on the website yet, but it will be shortly in terms of the actual publication will be up there shortly. And it's in the Indon this morning. In fairness, Charlie Weston has the full list or whatever. There will be more plans that I'll be highlighting in the coming weeks, but it will be on the website shortly where people will be able to view that article.
And your website is?
healthinsuranceireland.ie.
Okay, a final one, which is a more general one. Can you ask Dermot what he sees as the future for health insurance? Double-digit increases every year is not sustainable for customers, and decreasing cover doesn't offer great value for money. When will people start pulling out of health insurance and rely more on the public systems? Will health insurance become eventually a luxury only for the well-off? That's from Siobhan.
No, it's a very good question. What I would say very quickly on that is you need to budget for about 10% in terms of increases going forward. That's what medical inflation is. And by the way, Pat, compared to other jurisdictions, we're on the low end. Other jurisdictions, 20, 40%. That's the way healthcare costs are going. What I would say to people is, look, the insurance companies are being very creative to bring out solutions because they don't want to lose members. So there are options. I have this principle of managed care, and that simply means if I can put a little bit of risk on your policy in return for big savings, then for a lot of people that makes perfect sense. But too many people are attached to this idea, I don't want any risk and I don't want any excesses. If you hold on to that view, you're going to pay dearly.
So a little excess and you may save a lot on your premium.
Absolutely. And you can split your cover. So, two adults, they might have very different needs. You do not both have to be on the same policy. If in doubt, get advice. Do not let it just roll over, because that will cost you very dearly.
Dermot Good of healthinsuranceireland.ie. Dermot, thank you very much for joining us.
The Pat Kenny Show
with Aviva Insurance
on News Talk.